Colon cancer ranks third as the most common form of cancer and is the second leading cause of deaths related to cancer in the U.S. You can lower your risk of suffering from this very serious disease by following the guidelines listed in this video. First of all, get regular screenings. If cancer is caught in the early stages, it can be treated. You should get your first screening when you reach 50 years of age, and your healthcare professional will determine when your next visit should take place. Healthy, low-risk patients normally have this exam every 10 years. Stay as active as you can, because studies show that taking part in a variety of activities will reduce your risk of getting colon cancer. Have a regular exercise routine and participate in hobbies and sports when possible. Lower your intake of red meat and processed meat. This certainly doesn't mean that you can't enjoy a good steak once in a while or that you could never eat any such foods. It simply means that you shouldn't eat them at every meal. Watch your weight. The risk of colon cancer is higher in men who are overweight regardless of their age. Therefore, you can reduce your risk of colon cancer by eating healthy, nutritious meals and exercising regularly. Studies show that calcium and vitamin D can help to reduce your risk of getting colon cancer. But talk to your healthcare provider before taking supplements. Men should not have an excessive amount of calcium because it could increase their risk of prostate cancer. Be aware that there are a number of common misconceptions about reducing colorectal cancer risk. For example, many people believe that eating a lot of fiber will lower their risk, but studies have not borne this out. However, studies have shown that eating whole grains may be helpful. This is not due to the amount of dietary fiber they contain, but rather to some of the ingredients in them. Hormone therapy can lower the risk of getting cancer of the colon, but it can also increase the risk of women having breast cancer and heart disease. Therefore, it is not recommended. Symptoms. A person can have colon cancer for several years and not show any symptoms at all. It's a slow-growing cancer that takes time to cause problems. When you do begin to have symptoms, they can be so general that it can be hard to make the connection. Colon cancer symptoms include, but are not limited to, diarrhea and/or constipation, fatigue, change in bowel habits, abdominal pain, cramps, weight loss, bloating, and blood found in the stool. Other medical conditions can have the same symptoms sometimes as colon cancer. As a result, if you have any of the symptoms that have been mentioned, see your doctor as soon as possible. The bottom line is that a healthy lifestyle of eating good, nutritious meals and exercising regularly, combined with screenings when needed, can help you lower your risk of getting colon cancer. Considering this is a serious disease that can be fatal, you should do your part to stay healthy. If your doctor finds signs of colon cancer, you can be treated, and in many cases, the treatments are completely successful.